Welcome back to Living It Away. The Honolulu AIDS Walk has gone virtual this year, which marks the 30th anniversary.
We talked with the executive director of the Hawaii Health and Harm Reduction Center about its impact from successes to challenges. Today, Living 808 is visiting the Hawaii Health and Harm Reduction Center. I'm sitting here with Executive Director Heather Luss to find out more about what you do. Thanks so much for having us out today.
Oh, thank you for having me.
You know, we don't necessarily have the longevity of people knowing what the Harm Center is about, but tell me about the origin. People do know your work.
Thank you. So the Hawaii Health and Harm Reduction Center is just about to hit our 3rd birthday on July 1st. So we are emerged from the Life Foundation, the largest and oldest HIV organization in the Pacific, founded in 1983, and the Child Project, the statewide harm reduction agency, founded in 1989. So we had been collaborating. In fact, we've been co-located here in this office. So my joke is often that we were living together and just decided to get married, but then changed our name. So we really provide an opportunity. We have such a synergy in our mission. And the executive director of Life Foundation, Paul, retired. And so this is what the boards decided to do, is come together. And so, yeah, we're hitting our 3rd birthday in just a couple of weeks.
Well, we know a lot of great work has been done across this. And in fact, Hawaii has one of the lowest HIV transmission rates in the U.S. And how much is that attributable to the work that you do out in the community?
Hawaii does have one of the lowest rates. We're considered a low incident state. And the Department of Health has several reasons for that. One is our own Hawaii Department of Health was one of the first in the country to start doing HIV testing and have an HIV department back in the day. And then Hawaii was the first state in the country to have statewide syringe access or syringe exchange. That started in 1989. And again, we were the first state. And particularly the Department of Health contributes the low risk here, or the low rates here, because people were not getting it through needles. They weren't passing it to their partners or their children. And then lastly, we've had a very concerted Native Hawaiian case management program that's really worked with families and individuals in our communities to really ensure that HIV is not only not spread, but it particularly doesn't get into the keiki. So we have a very low rate of mom to baby transmission in Hawaii because of some of the reasons I mentioned. But again, we didn't do it alone. We have fabulous sister agencies on each neighbor island, and our Hawaii Department of Health was really a nationwide champion when it came to eliminating HIV early on.
What are some of the challenges that you still face in reaching the vulnerable members of the community?
Well, to be honest, a lot of people feel like I don't see HIV anymore. HIV isn't an issue. And why that's not true, we really need to make sure that people are aware of HIV, because there's so much they can do. One of my biggest obstacles, if you don't think there's something out there that you're at risk for, you're not going to try to prevent it. So there's a great new treatment that can actually prevent HIV. It's called PrEP, or pre-exposure prophylaxis. It's 1 pill each day, and it allows somebody at risk for HIV to actually prevent it. We have a point of care or rapid testing. We can find out in 2 minutes if somebody has HIV. So we'll be taking this test out into the community to try to really encourage people to get tested, because if you don't know you have HIV, then it can still be a death sentence. But if you know it, you can get treatment, you can live a long, healthy life, and now with this new prevention, you can also prevent it. So we really want people to know about these technologies and these advances in treatment, because again, we can continue to be low in Hawaii and get what's called Hawaii to zero, which is no new HIV infections, no HIV-related deaths, and zero stigma. And that is what the Hawaii to zero kind of concept is getting to those zeros.
Well, let's talk about some of the initiatives too. I know you had the mobile medicine unit, for example.
So we launched right across the street here on June 1st. Is going to be taking that point of care test into the community. We're also, we just got funded to be a homeless outreach from the state, and so we'll be really kind of specializing in the downtown and also the northern windward side, and taking the MMU out there. We have also a growing behavioral health program. We have a new stabilization site in Waikiki that is in collaboration with the Department of Health, where people who need a little bit of time can come and get whether it's support for their mental health or substance use, and then we can get them to that next level of care. And we have done that for COVID, and now that COVID's going down, luckily, we're able to bring in other folks into that site. And then lastly, we're really building our behavioral health program. So to be able to support, I don't know about you, but I know so many people I know are suffering from whether it's depression or anxiety related to COVID. So we're really seeing the need in the community to increase. So both in the MMU or medical mobile unit and in here, we're providing a lot more mental health services.
Well, we thank you for having us out to explain some of the work you're doing and some of the work that you continue to do in the community. So thank you so much, Heather.
Well, thank you for visiting us today and for focusing on HIV. It's a really important month. Thank you.
It is an important month, and our focus continues. We've been doing all these segments as we lead up to a TV special coming up tonight.
Yeah, and that program's going to air right here. It's a look back at how far we've come in the fight against HIV/AIDS, and it continues tonight with a special program on KHON2.
It is called Friends for Life, History and Legacy of Hawaii Health and Harm Reduction Center. Again, it's celebrating 30 years of the Honolulu AIDS Walk, thanks to support from sponsors like Lead Sciences, Kaimana Beach Hotel, 5 Minute Pharmacy, Alaska Airlines, and UHA Health Insurance.
Program airs tonight at 9:30 right here on KHON2, and it's going to rebroadcast, but you can check your local listings for that.